All new at 10, according to DHAC, between 2014 and 2019, South Carolina saw a nearly 75% increase in the number of prescription opioid overdose deaths. And nationwide studies show that 1 out of 8 people who are prescribed opioids will become persistent users. That's according to Prisma Health. And substance abuse during the pandemic is not making things any better. No,
not at all. Fox Carolina's Zach Polutsky live outside Prisma Health with the story.
Yeah, Cody and Tori, definitely some alarming statistics, but there is some good news now. Also, according to DHEC, between 2018 and 2019 here in Greenville County, the number of opioid overdose deaths actually dropped by around 30. Now, there's no data available yet for 2020, so a full picture of how the pandemic is impacting this, not yet known. But here at Prisma Health, over the past few years, they have been working on changing how they prescribe opioids to patients. But I did talk to some local treatment centers. They also say that they're seeing a change as well in the types of opioids people are becoming addicted to. Since 2017, Prisma Health's Opioid Stewardship Council has developed new prescription practices and measures by improving education about opioids, monthly data reviews, among others. The health system says that has led to a nearly 50% reduction in the amount of opioids prescribed.
We have to understand the treatments that we use for our patients can have some unintended consequences on occasion. And if we're not paying attention, we can sort of miss the mark, so to speak.
At Solutions Recovery Center in Greenville, the around 188-bed facility has been working at capacity for a while. Chief Operating Officer Paul Lombardo says he has seen a shift in what the center deals with when it comes to opioids over the past couple of years.
A year or two ago, it was a lot of opiates, as in like, heroin, oxys, pills, stuff like that. Now it's specific to fentanyl. A couple years ago, it was like, fentanyl was mixed in with the drugs. Now it's just specifically just fentanyl.
Fentanyl is rarely prescribed at Prisma Health, according to Dr. Walker, but he says that coming to a hospital for a procedure is often the first time people are exposed to opioids.
Addiction and pain does not discriminate. Men, women, all ethnic backgrounds, socioeconomic statuses, and everything else can be affected by both of these problems, pain and addictions.
The Prisma Health opioid approach in the upstate is in the process of being expanded to its hospitals and physicians in the Midlands. Now, I did also speak with people at the Phoenix Center, another addiction treatment and rehab facility here in Greenville. They say in the second half of 2020, they actually saw about a 30% increase in people coming to their detox facility. That's for people with alcohol and opioid problems. The center has also started putting out PSAs like this. So whenever you walk into a hospital, a doctor's office, or a pharmacy, you'll see one of these pop up on your phone trying to educate you about the dangers of opioids. For now, reporting live in Greenville, Zach Polutsky, Fox Carolina, the 10 o'clock news.